Hi everyone, thank you for joining us today. Thank you, Bill, for speaking today. It's great to have you here. So Bill Howatt is a doctor and a postdoctorate behavioral science of the University of California, Los Angeles, Seminole Institute for Neuroscience and Human Behavior. He is a founder and president of HowattHR. Dr. Howatt is known as one of Canada's top experts in mental health issues in the workplace and has more than 30 years experience in the field of mental health, addiction, and human resources consulting. Dr. Howatt has published over 40 books and 400 articles, such as Stop Hiding and Start Living and The Coping Crisis. Thank you again for speaking today, Dr. Bill Howatt, and good luck with the presentation.
Thank you. Welcome, everybody. We have about 20 minutes, and then we'll have a few minutes for Q&A. What I'm going to do is just introduce a concept around psychological health and safety. It's a conversation that's starting, and more organizations are starting to ask themselves what they can do to have a positive impact in the workplace. First of all, it would be probably of value to say, okay, what is psychological health and safety really referring to? Well, in Canada in 2011, the Health Canada, in partnership with Mental Health Canada, created what was called the National Strategy for Mental Health. And then 2013, CSA and the Mental Health Commission of BNC created what was called as a National Standard of Psychological Health and Safety. It was the first voluntary standard of its kind globally. In fact, today, globally, they're following, a lot of folks are looking at the Canada's original work. Now, the standard is something I've deeply been passionate about for the last 7 years. I'm on the steering committee that oversees all the OHS standards in Canada. I'm the chair also of the National Standard Impairment that's coming out this March. It's a wonderful resource. It's going to be free to public domain. It's going to have an implementation guide and trainings for organizations. And we're going to be really focusing on helping organizations reduce the risk of substance use in the workplace. And it was an initiative driven by the government with the cannabis legislation to help organizations across Canada, small, medium, large. With the change, what happens is with many change, there's often a lightning rod. Well, COVID has created the perfect storm around mental health. And the purpose of a psychological health safety initiatives, whether you adapt or adopt a standard or looking to try to improve the mental health in the workplace, it really comes down to two simple variables. How do we reduce mental harm and promote mental health? And if there is a gray or silver lining in the COVID situation, it's actually increased the openness for organizations to be looking at how can they better support their employees. Being caught in a pandemic for 12 months, in my 33 years of working with organizations, I've not seen as much suicide, domestic violence, increase in substance use in organizations. And some organizations may be seeing it, some may be seeing more. Chronic stress, strain, these things are happening, feeling overwhelmed. And so what happens is that we've done a pretty good job of putting in place for what happens when someone needs help. So if someone who's seen patients for over 33 years, I understand the benefits of cognitive behavioral, EAP, access to psychological service. These are well needed when people need someone to talk to process. However, prevention right now is really at the genesis what I think we need to get better at. And this conversation today is to introduce some ideas around what can organizations do to have a positive impact on psychological health and safety? Well, it would start with actually understanding a little bit the difference between mental health and mental illness. One of the challenges because of stigma, self, peer, and organizational stigma is lots of organizations have been struggling to try to get some evidence of what they're doing. So we're starting to see more organizations move to evidence. However, evidence to do what? Well, 1 in 5 Canadians had a mental health issue before COVID. I led research with the Conference Board of Canada, the Mental Health Commission of Canada, found that there's an 84% increase in level of concern across 15 factors. Human beings in Canada, the brokest regions getting tired, more people are in caveman brain, more people are just tired of being tired. And so what's happened is the adrenaline's worn off and psychological stamina, and people are trying to push through. And so what we're really starting to notice now is lots of people's general sense of well-being is challenged. And when I think about that, we're still people, when they hear the word mental health, they're thinking about, well, this mental illness. Again, 1 in 5 Canadians before COVID had a mental health issue. The big stat is 7 out of 10 never were getting any help. Really, what I'm talking to you today about is when you look at a psychological safe workplace, we're talking about the 5 and 5. What can we do with intention to support all our employees, reduce the risk for mental harm, Promote mental health with intention, because human beings are a finite resource. Now, if I asked most of you what the algorithm is for physical health, you would know exercise, diet, rest, relaxation, lifestyle choices. You know, if you drank a 2, 4, and ate pizza and did whatever you wanted, never exercised, in time, you could be at risk for obesity or type 2 diabetes, whether you pay attention or not. But sadly, so many people get sick before they get healthy. However, we know the algorithm. If you ask the average person, what's the algorithm for mental health? They don't know. So part of the reason why 2030, in my opinion, mental health will be one of the leading causes of premature death on the planet, why suicide represents 2% of the mortality rate globally, is that we don't have a frame of reference, the average person, how to manage their emotions. We have between 12 to 70,000 thoughts a day. Most human beings are probably closer to 40 to 70. 80% of their thoughts from research arguably is negative. Human beings, their negative emotions are in different hemisphere than their positive. Human beings overvalue negativity, so they're more powerful. We wrote on those more. Human beings, for example, if we're in public domain calling someone a shithead or being rude to them, we call that bullying, harassment. But we're not spending time with all the negative thoughts people are telling themselves, because people, what they say to themselves is a form of almost self-harassment, some folks, of all their negative thinking, but they don't have context. So because they don't understand neuroplasticity, what's happening, they're developing neural networks in their basal ganglia, which represents 40, 60% of all their programming. They're storing, failure programming they don't know. So when they get emotionally overwhelmed, programs take off. And so if we could just step back and just say, okay, if I'm facilitating HR and I'm a leader and I don't know what the algorithm is for mental health, and if I asked you this question, when you woke up this morning, what was your mental fitness plan? And if you answered, well, I don't know what it is because I don't know what you're talking about, or you feel compelled, I better make something up for my self-esteem, because we don't want that voice inside to say we're doing something, because it's important for us, most of us, and I'm not trying to be pejorative at all, to put a face on to create the illusion we're okay. But underneath the water, like an iceberg, there's lots of people struggling. So human beings move between flourishing, reacting, languishing, and their emotions drive them. See, thoughts are what come in, emotions drive behavior. So if we want to impact mental health proactively, then what happens is the environment represents 10%. And if we understand the social determinants of health, then we realize that the environment can play a big role, like food, shelter, access to healthcare, psychological services. But employers who take it serious that they can play a role in prevention and early intervention and supporting employees' mental health, then have a role. Psychological health and safety is something you do with intention. It's not a bunch of random acts of wellness. It's actually, if we're going to do it correctly, we measure what we're doing to see if what we're doing works. In regards to employee mental health is, 50% of it's genetic, 40% of it's intention. So if employers really want to help employees, they can't write enough checks to fix this. It's not about a bunch of programs. It's about employees actually learning and developing skills to be able to build their mental health with intention. And 3 factors that drive it are physical health, the mind-body connection, rest, sleep. That's critical. Social connections. I have a book coming out, releasing globally, called The Cure to Loneliness. It's on my website, billhowatt.com. And what I've realized from my research from COVID and the work I do with the Globe and Mail is that there's lots of human beings that the absence of social connections and loneliness often is a byproduct of people who have never developed relationships with themselves. And so when people don't have these skills and they get lost in building relationships with themselves and they're unclear of how to do it, their mental fitness is pro-social behaviors, at-risk behaviors, help-seeking behaviors, and pro-social behaviors is when employees or individuals do things with intention that are good for their health that don't harm other people. And what's amazing about most people, if they don't realize how little you need to do to feel good. But here's the truth. I live in Ottawa with my little dog, Link, and in a condo. And because of Ottawa and like lots of parts of Ontario and Canada, the gyms are closed. So I had to buy a Stairmaster. You probably know if you get on a Stairmaster once, you don't get shredded Like you got to get on the damn thing a bunch of times to get in shape. And you do it over and over and over. So physical health requires intention. It requires a plan. You need to know what levers to pull. There's no magic solution. See, there's no shortcuts to being fit. Well, mental health is the same way. There is no shortcuts to being fit. One of the things we do at Howatt, we help organizations get a baseline to help their employees get a mental fitness plan. So they learn how to actually move if they were feeling red, helpless, and hopeless to yellow, to be able to move past barriers to green. So they can actually move from languish and reacting and flourishing, and teach them what's happening. We teach them a little bit about behaviors and understanding why. We teach them a little bit about brain health, what's happening in their brain. You know, most people don't realize that their brain's wandering 49% of the time because of neural default network and how their brain is wired for scanning. And so what happens is lots of people are missing things. And so lots of folks are trying to do the best they can. So a part of creating a psychological safe workplace, if you really want to do this well, and you really want to create inclusion, and you want to really create a place that's welcoming, and you really want to drive fear out of a culture, it's critical that employees know how to self-advocate as well. And so it's dynamic in this two ways. On both sides, both the employee and the employer have a role in creating a psychological safe workplace. And what we do, what we believe is human beings are much like a battery. And so there's things that they can do every day. They can charge the battery. See, resilience workforce, resilience is critically important to build a resilient workforce for sustainability. But that doesn't happen by hapstance. Resilience, if you look at the definitions, about pushing through setbacks and being able to put the pieces together and be able to put one foot forward after, you know, or push through a challenging period. But if your battery is really, really drained, you're not going to be able to have the ability to do it. So what we really want to do is teach people what they could do to start to charge the battery. So what can the employer do with intention, and what the employee can do with intention. And when we're able to do that, we're able to have some impact. And when we're able to have some impact, we can start to see some progress. And what happens for organizations that want to commit to this, one of the key elements of psychological health and safety in the workplace, based on the standard, if you're adopting it using a plan, do, check, act, is there is no goal line. Like I hear people tell me sometimes, oh, I've implemented the standard. You haven't implemented the standard. You're facilitating the standard. There is no goal line. The standard's not about having EAP, train my managers, and have a mental health strategy, and we do Bell Let's Talk. That's not the standard. The standard is getting evidence of what the psychosocial factors are in the workplace and the psychosocial hazards in the workplace, and what is the policies, programs, and behaviors that will drive the key performance behaviors, the things that help people thrive, that can drive the key performance indicators that can get the outcome that are audible, measurable, and definable. So when you'd have these quick, rapid talks, the question is okay, there's programming and there's auditing and conformity checks and key stakeholders. Having 35 different programs the average employee doesn't know how to access or when they're allowed to is really of little value. So slowing it down and starting to say, okay, what does the word safe mean in our culture? If we could start to really remove fear, a place where people can speak up, then we can start to move and start to replicate research like Google did with the Aristotle Project. Then we can start to have really, really good impact. And when we can start to have really, really good impact, then we can start to create a place where we're actually reducing mental harm. And what I find, one of the things we have done is that we have lots of folks that are giving these initiatives that may not understand a management system or being trained. That's one of the reasons why we spend time creating what's called a psychological safe facilitator certification. In other words, how do you train people how to implement a psychological health and safety strategy that's evidence-based? We also provide tools to help them as well, as we are creating the first National Psychological Health and Safety Award for the most psychological safe workplaces in Canada starting this year. And we're going to be giving people access to tools that traditionally used to cost tens of thousands of dollars to get access to for very, very, very low economic spend. The reason being is As I get older, one of the things I'm becoming more clear of is that with the research I do with CSA and the Mental Health Commission, the Canadian Psychological Association, and other large organizations like WSPS, is that we need more evidence. And we have to stop thinking that the concepts around just checking the box. And that gets to one of the things I think is a great opportunity. Through the University of New Brunswick, we've created what's called the University of New Brunswick, we've created a certificate, which Senate approved, not the University of Frederick did, but the University of New Brunswick, a certificate in psychological safe leaders. That's so, because my belief system is I don't think employers need to be spending $1,800 or $1,500 a leader to get them basic skills for one course. I think they can do 2 or 3 online courses, spend a couple of $100s, and get enough baseline that they can start to remit the forgetting curve and start to practice and learn how to get these skills. And the reason being is we can get leaders to start role modeling and starting to have them understand what is a psychological safe leader, understanding that some leaders may never really have answered the question, do I like working with human beings? Because we don't usually ask that. So as we start to evolve, which we are, and mental health is becoming more important, a critical element for psychological safe workplaces will be psychological safe leaders who get the skills, but they need to be able to role model. And one of the most important things we need leaders to do is make sure they're taking care of their own mental health first. That's one of the best gifts I can give, and helping them get their own mental fitness plan, because they're employees and humans as well. We also want leaders to learn, become aware of how they show up, their wake, what that wake is, and how important it is for them to spend some time on being clear about their wake. And that gets into micro behaviors, everything from empathy to how they follow through. And these are all skills when you have more time we can talk about, because we want them to become aware, working with the organization, of how hazards, for example, isolation can lead to harms, which is psychological hazards, which can move down the road. Isolation can move into loneliness, how work demand can move to fatigue. So you have psychological factors and psychological hazards. And knowing that what the levers are by recognizing these signs early upstream and figuring out what the employee and the employer can do in partnership to reduce them. But sometimes, because how we organize work, and we're learning how to work remotely, and people are starting this whole experiment of working remotely is not over yet. Micro interactions, people are going to struggle. And that's one of the reasons why I've written a book called The Cure to Loneliness, is that my belief system is that human beings need support on how to do that. Leaders also, and I'll do a couple more minutes and I'll take some questions because I want to make sure I stay right in time for you, is that we have to also ensure that leaders know and understand how to do informal support. You know, and if, for example, if I go start my car and it doesn't start, I reasonably ought to know there's something wrong with my car because there's been a change in pattern. When I start to observe changes in patterns and behaviors in employees over, one day it could be informal, but if I start to see a trend pattern 3, 4, 5 times, it's factual, it's not supposition. It's not about I feel they're doing this, I'm observing them, they're late, they're missing assignments. Instead of going right to performance, under human rights, everybody, like people who are like me, who live their entire life with a mental illness, we are protected under human rights. And so we're allowed, if we have a duty to inform, employers have a duty to inquire, and that leads to what's called a duty to accommodate. So if we can train leaders to be early to help support the employee's experience in the workplace, that can reduce mental harms and promote mental health and help charge batteries and reduce drains. But in times, because of how work and just being human beings, being fallible, people may need support. And teaching leaders, they don't need a 2-day workshop in anxiety or depression, because I only spent 10 years of my life to get a PhD how to do that. So why would we expect in 2 days? That's not a leader's responsibility. I don't want them dealing with psychology. I want them to deal with behavior and safety. And so they can learn how to observe behavior, learn how to evaluate it, learn how to prepare to have a safe conversation that's non-threatening, learn how to have an open discussion to help employees solve that challenge, to get access to the resources support, whether it's private or public, whatever level size the organization is. Large organizations often have more private access. Very small organizations typically need to use public if they don't have EAP or et cetera. And then follow through. So my quick rapid introduction today in that very short period of time is just to give you some insight that I believe that mental health in Canada is going to become more of a topic of discussion. I believe the fourth wave, if you look at disaster management research, the fourth wave of mental health hasn't hit yet. Expect that probably is going to be hitting pretty hard in the fall or next winter. Expect that once the vaccines get over and we start to try to get the economy moving and we start to deal with all our fiscal accountability, as we're moving into inflation, you're seeing oil prices go up, transportation prices are going up, means plastic's going to go up, food's going to go up. So if that happens, inflation may happen. We'll have some movement perhaps. I think there'll be a lot of pressure to keep interest rates down because of the challenges with debt, et cetera, especially Canada. We've put on $500 or more billion of debt since this whole thing started, considering that we were probably around 700 or 800 billion, and now we're at 1.2 or 3 trillion. I've lost count. So you start to think about what's happened to our country. We're going through a massive thing. Here's the bottom line. We're going to get through it. We will get through it. But we need leadership now from HR at a time more than we ever had to get folks focused on what we can do. We need to stop guessing. We need to get evidence. And we have to realize these things called human beings are finite. They don't have an infinite capacity. And just because, somebody says, we'll get through it, or, suck it up, buttercup, those days are gone. Research is showing if you're under 40 years old, one of the most important things employees are looking for is employers who care about their mental health and their well-being. So this will be in the history books, what we're all going through. And 5 years from now, we'll look back at this with lots of profound and provocative learnings. But for now, we need to, my opinion is, get focused on it. So I'm open to take any questions. I don't know who's moderating this process. So I'll hope that there's somebody in the sky here who can do that. Is there anybody out there? All right.
Hi, Bill. Can you hear me?
Yeah, I can, Alex.
Sorry about that. I was just having an issue with my microphone. So yeah, I put a message in the chat here just in case anyone has any questions. We do have a comment here from Nick Godfrey. So he just said very informative. We also have a comment from Mark Glacier. He says, thanks for the presentation. But yeah, I'm just going to stay on here and moderate if any questions come in. I don't see any right now, unfortunately. But I just wanted to say otherwise, that was a really great presentation. And thanks.
Yeah, I can't even tell is there anybody even here?
Yeah, there is people here. I know like the PowerPoint kind of takes up the whole screen, so it's hard to tell. But there is people in the session. If people want to get in touch with you, what's the best way?
Just go to our website, www.HowattHR.com.
Okay, I'll just put that in the chat here. So HowattHR.com?
Yep.
Okay, great. And if they want to contact you directly, should they go through the website as well, or email, LinkedIn?
Yeah, just go to the website and then
okay.
Email, and then someone on my team will get a hold of it.
Awesome. From your presentation, what do you think is sort of the key thing to take away just from your presentation in general? If you could just, sum it up, I guess. Sorry to interrupt you.
No, it's fine. My big focus, what I focus on is what is our strategy to reduce mental harms and promote mental health with evidence. That's really what it is.
And I apologize. I'm not entirely sure. I can't quite remember if you went over that in your presentation, just sort of strategies for that. But what do you think some of the key strategies for reducing that is?
One is really supporting leaders to be psychological safe leaders, and the other is to really support your employees develop mental fitness strategies.
Yeah. And do you think that it's sort of a harder process to do, or is it easier, or it just kind of depends?
Each organization will have its own cultural challenges, depending on sector, depending on what the organization's doing. I mean, ultimately, senior leadership has to make a decision if they think that human beings' mental health is, something that they care about and concerned about, and if they want to help support.
And I think you might have touched on this briefly during your presentation, but how do you think COVID in general and working from home has really impacted sort of mental health efforts that companies were making and are making now?
Yeah, I think the jury is out on that. There's literature coming out saying that employees are still struggling quite a bit around isolation, working remotely. I think one of the big ones right now is that since COVID, we do know that there's been an increased level in folks' just general level of concern, which is not a good thing, because whenever you have more stress, more cortisol, you have more risk for people having mental illness.
Yeah, definitely. I know that definitely a lot of people have really struggled with just working from home, because you're isolated from really your team, and you do have your family at home, but as well it is sometimes, maybe if you're living alone, you're kind of isolated from everyone in that sense. So it definitely is really sort of a really different experience for everyone, right? So I think everyone is kind of unsure the best practices really to juggle, or not juggle, but sort of get used to this, and also try and deal with any mental health issues that they might have had or that might come up during this, I guess, lockdown, right?
Yeah, 100%.
And I know we only have about 3 or so minutes here before your time is up. So I just wanted to say again, thanks for your speaking. It was a really great presentation, really interesting and engaging. And just to let you know, so there is a recording of your presentation available. So if you'd like a copy of that, I can certainly send that to you.
Oh, thank you.
And if anyone, I guess if anyone wants maybe a copy of your slides, can they reach out to you through your website again, or just email you?
Sure. Yeah. Okay. Go ahead.
Awesome. Do you mind if I just put your LinkedIn in chat, maybe, just in case anyone wants to
Sure.
through there?
Sure.
Awesome. And just to let everyone else know, so our sessions are done for today. So Bill was among the last sessions for today. So in about 10 or so minutes, we will have our panel on the main stage of HR professionals. So that will just be on the stage. But thanks again, Bill. It was a really great presentation, really interesting. And I really learned a lot from it about just kind of things going on in mental health right now and just in general.
Thanks a lot, Alex. You have a wonderful day.
You too.
Bye. Bye-bye.